You're welcome to yet another episode of Easy Access to Healthcare for All, a program sponsored by the National Health Insurance Scheme (NHIS) to keep you abreast of its stride as it moves Nigeria towards attaining universal health coverage. My name is Aisha Muhammad Ahmed, your regular anchor. Towards ensuring that everyone is carried along in the efforts by the NHIS to attain universal health coverage, the management of the scheme has made conscious efforts to keep the public informed of its stride and achievements. It is along those lines that the Executive Secretary recently called a press conference to highlight the successes and achievement of the NHIS in the last 3 years. Our program this week, therefore, will focus on the high point of this briefing while reinforcing some of the achievements by the scheme. These, alongside other segments of the program, will complete our package this evening. Do stay tuned for details after this short break.
Easy access to quality healthcare for all. NHIS.
We begin with the highlights of events around the NHIS. In the news, NHIS subsidizes cancer medication for enrollees as Cross Rivers begins enrollment of workers into its state health insurance agency.
The National Health Insurance Scheme has commenced the administration of cancer drugs to patients under the scheme. This was disclosed by the Executive Secretary of the scheme, Professor Muhammad Nasir Sambo, at a news conference held on the 26th of April 2022 in Abuja. The Executive Secretary said the implementation of this initiative has commenced in 6 hospitals across Nigeria, including the University of Benin Teaching Hospital, Aminu Kano Teaching Hospital Kano, National Hospital Abuja, and the University College Hospital Ibadan. The inclusion of the drugs for the treatment of cancer patients under the National Health Insurance Scheme is a product of an MOU between Roche Nigeria and the NHIS to make cancer drugs accessible and at a subsidized rate for enrollees when the need arises.
The Roche, which is a very well-known pharmaceutical company, did not even wait to come into collaboration with the National Health Insurance Scheme to say that they want to quickly start manufacturing drugs for cancer, and they are ready to give about 50%, 30%, 50% subsidy for the National Health Insurance Scheme. That is to say, if a drug is 100,000 naira, Roche will be able to sell it to the National Health Insurance enrollee at the cost of 50,000, and the National Health Insurance Scheme will pay 30% of that cost. Then the patient will only pay 20% of that cost.
The Cross River State government has flagged off the formal sector enrollment into the state's health insurance scheme, which approves a monthly deduction of 1,000 naira from workers' salaries. The Cross River State coordinator of the NHIS, Mrs. Margaret Murphy, while speaking at the event, commended the state government for the initiative. She advised the government to create a board for the agency so that the scheme can run effectively. The Director General, Cross River State Health Insurance Scheme, Godwin Iyala, noted that the scheme will enable workers in the state have access to affordable and quality healthcare at any healthcare facility within the state. Also speaking, the state's head of service, Timothy Akwaji, noted that the scheme is mandatory for all civil servants at an affordable cost.
Welcome back. The program is Easy Access to Healthcare for All, a program that brings you highlights of news and happenings around the National Health Insurance Scheme. When the Executive Secretary of the NHIS addressed a news conference recently, highlights of its various achievements in the last 3 years were brought to the fore. Capacity building, automation of NHIS business processes, NHIS Medicine Supply Initiative, and the Giveshift Program were some areas of success itemized. Let's get details of the successes recorded as we report the press conference alongside other issues.
Easy access to quality healthcare for all. NHIS.
Professor Mohammed Nasir Sambo, on assuming office in 2019, was handed a list of 10 presidential action points for immediate implementation. In the light of this, on Tuesday the 26th of April 2022, the scheme organized a world press conference in Abuja to keep Nigerians abreast of the achievements so far made. One of the first things he addressed was the 3-point rebranding agenda adopted by his management with a view to transforming and stabilizing the organization towards attaining its mandate.
The rebranding agenda is anchored on 3 basic pillars. Number 1, restoring a value system that will transform the organization into a credible, result-oriented organization. Number 2, engendering transparency and accountability in the entire operation of the scheme. Number 3, accelerating the drive towards the attainment of universal health coverage.
Professor Sambo and his team have been working assiduously to see that the scheme is focused towards achieving universal health coverage. On the presidential directive he received, Professor Sambo said by the end of his second year in office, all but one directive had been fully achieved.
I'm happy to inform you that by my second year in office, all but one directive had been fully achieved. Instructively, the presidential action points include the conduct of comprehensive health insurance and human resource audits to address all the lingering HR issues, including promotion and discipline. This assignment has been achieved thoroughly.
To revitalize the scheme, Professor Sambo began with a long-term plan that will put the scheme on a path of success.
It is a well-established fact that failure to plan is a plan for failure. To this end, the scheme has developed a 10-year strategic plan, 2020 to 2030, which serves as a roadmap for achieving its mandate. The implementation of plans has commenced in earnest. With this all-important document, efforts toward attainment of universal health coverage in Nigeria is now well focused, and the milestone can easily and accurately be tracked.
Another milestone reform embarked upon by the scheme is the automation of its business processes.
To develop a comprehensive digital technology infrastructure, which is called eNHIS. This infrastructure developed by national sites and its partners will completely automate the health insurance business process in the country.
Professor Sambo also spoke on the introduction of an innovative program that is bringing everyone on board in the health insurance space, known as the Giveshift Program.
Giveshift is designed to bring the informal sector groups into health insurance ecosystem. In line with this, individuals, families, groups, associations, philanthropists, as well as Nigerians in diaspora can have opportunity to contribute and benefit from the program.
As part of NHI's effort to fulfill its mandate of achieving universal health coverage, a platform to coordinate the health insurance ecosystem was created. It is the Health Insurance Under One Roof, which will also foster the implementation of the Basic Healthcare Provision Fund. Another milestone achievement of the scheme, which Professor Sambo spoke about, is the NHI's Medicine Supply Initiative.
This initiative is designed to address the lingering problem of out of stock, as well as incessant complaints of substandard drugs by the enrollees. Under this arrangement, drug manufacturers will manufacture NHI's branded drugs at a cheaper rate, therefore addressing the issues of availability, accessibility, affordability, and quality drugs for our team enrollees.
The workforce of the scheme was not left behind, as the scheme embarked on a series of capacity building both for members of staff and its management team.
In the areas of capacity building, NHIS has trained over 425 staff in ICT through our collaboration with Digital Bridge Institute. NHIS has also trained a total number of 927 staff across its headquarters, zonal offices, state offices in the new business process that has been developed. Recently, the scheme unveiled the Nhs Leadership Program, NLDP, which is being implemented with the support of development partners, R4D, and all the general managers in the scheme have been trained, and the training will soon be extended to NHI state coordinators and chief executive officers of the state health insurance agencies.
Other reforms in the last 3 years of the present administration of the scheme include the amendment of the NHIS Act, awaiting presidential assent, recruitment of relevant medical personnel, development of comprehensive business processes, and periodic engagements with relevant stakeholders, etc. The Executive Secretary gives credit for the successes recorded to the support and hard work of his management team. Speaking in separate interviews, members of the management team speak on some of these initiatives. Dr. Abubakar Kurfi speaks on the 10-year strategic plan, as well as mechanisms to monitor and evaluate its implementation.
We are aware that most plans that are developed are not implemented, but this is a plan with a difference. Already all our this year's budget is developed from the 10-year strategic plan. We have also put in a mechanism to monitor and track implementation, and we have also developed what I call an accountability framework for the 10-year strategic plan. So we are going to hold departments, divisions, units, and other stakeholders responsible, when for implementing this plan. And we are going to work collectively with all stakeholders to ensure that we implement this plan to the latter.
On automating the operations of the NHIS, Prince Nasiri Karo says this has made access to social health insurance easier, as the use of ICT saves the scheme a lot, and there is no comparison between the NHIS before and now, especially in the registration of new enrollees.
We are now electronically enrolling our enrollees into the system. So with that done, the register will now be at a click of a button. We already launched our servers, both at our various server locations. I don't want to mention that on camera, but yeah, we have them at our various locations. And this is now allowing us to keep that promise that if you do registration, you will be in our database within 72 hours. You will be in our database. The only thing is that this health insurance still have its own business rule. Okay, it will take 90 days. Well, that's official. It will take 90 days before you can actually access care.
On the Giveshift, Dr. Eke Jonathan described it as a novel program created to prevent abuses through the introduction of checks and balances.
We said, okay, a waiting time of 3 months. So by the time, if for nothing, it gives us the time to do the administrative work. And once your name appears on the register, you can start accessing service. Though we are realizing that from what we are getting in the field now, some of the stakeholders are telling people that even when their names appear on the register, they'll still wait for another 3 months. That is not correct. And that is what we want to tell them. The waiting time is 3 months It gives us time to do the administrative activities to bring the person on board.
Health insurance under one roof brings state health insurance agencies, the NHIS, and other stakeholders in the health insurance ecosystem together towards one goal, which is the attainment of universal health coverage. Stakeholders laud the initiative.
So the health insurance under one roof is just an innovation of the new leadership of the NHIS to bring everybody involved in the health insurance ecosystem under one umbrella, and that we can have, the industry regulated and then coordinated in such a way that we can have unitary, even getting towards having an electronic platform.
With health insurance under one roof, it means what we're doing in Taraba State, what the NHIS is doing, and what some other, or rather the remaining states of the Federation and the FCT are doing, will all add up, and we'll be able to say, oh, Nigeria is on course towards achieving universal health coverage.
Dr. Yakubu Agada Amade explains the Medicine Supply Initiative. He says it targets 3 core areas, which include branding of drugs, cost sharing, as well as innovative financing.
Drugs, there are 3 core components of this particular initiative. The first one is branding of drugs. So we are going to brand drugs. So you have drugs produced by manufacturers, and then the manufacturer logo is there, NHS logo is also there to show that this is a drug from this manufacturer. It has been ascertained by NAFDAC, and NHS is aware of these drugs.
The last 3 years have truly advanced the NHIS in the pursuit of its core mandates. Healthcare for all Nigerians is truly a more realizable target because of some of the breakthroughs recorded by the scheme in recent times.
The program continues with our stakeholders segment. In this episode, we feature Alhaji Mahadi Shehu, Chairman, Dialogue Group of Companies, owners of Mahadi Clinics, Kaduna, a healthcare facility with enrollees under the NHIS scheme. He shares his thoughts on issues surrounding health insurance. First of all, he speaks on the act establishing the scheme and calls for a much-needed amendment.
With the new sheriff in town at the NHIS, Professor Sambo, we hope gradually he will have a second look at the law established in the NHIS and make the necessary adjustments through the legislative processes so that he can also deliver credibly, so that we can also deliver credibly. But as at now, there are obstacles on the way, especially on the act established in the NHIS.
Mahadi speaks further on some challenges healthcare facilities encounter while dealing with some HMOs and applauds the NHIS leadership for its interventions.
With the coming of the new regime of NHIS under Professor Sambo, he has sent a very clear signal to many of them. They have come back to the line. They are now more responsible and more responsible. Many of them are now repented HMOs.
He further commends the new leadership of the scheme for some of the reforms it has initiated to help strengthen the NHIS.
In the past, if you write a letter to NHIS, whether state, zonal, or national, as a service provider, as a necessary partner, as an indispensable partner, it takes you a year to have the reply, if we ever have that reply. But now we are amazed to see that we write a letter today. If it is early in the morning, by late evening, we receive a reply. Good or bad, at least we receive a reply and we know the position of things. Secondly, we've seen a great improvement on involving professionals. In the past, everybody goes for accreditation. Most of them don't even know what they are doing, going to accredit. But now, doctors are involved, pharmacists are involved, scientists are involved.
It is not all roses, as Mahadi Shehu also shares his displeasures on issues around lines of communications between leadership of the scheme and the stakeholders.
NHIS should look at we service providers as the most important component of the scheme. Without service providers, without we facility owners, the NHIS scheme cannot be implemented, whether at private or at a government level. Therefore, we should be seen more as partners than as parasites or than as nuisance. I'm saying this because the language of communication, when they are communicating to us, the language is that of a dictator. The language is that of a master over a servant. We are not servants. We are partners.
That was Mahadi Shehu, Chairman, Dialogue Group of Companies, owners of Dialogue Clinics, Kaduna State, sharing his thought as a stakeholder in the National Health Insurance Scheme. Let us take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: how can a child above 18 benefit from NHIS?
They can continue enjoying under what we call the extra dependents. We pay the sum of 15,000 naira and they continue to access services under the father or the spouse, the mother. All right. Then the person can either join the university. If you go to the university, you will now join what we call the Tertiary Institution Social Health Insurance Program, we call it Giveshift, in the schools. Or you can join our latest program called the Giveshift.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
This is where we draw the curtains on this episode of the program. Join us again, same time, same station, on another episode as we continue to bring you more stories of happenings around the NHIS. Follow us on YouTube and other social media platforms for more on the NHIS. Till I come your way again, enjoy the rest of your day.
Easy access to quality healthcare for all.